I am a obstetrics and gynecology specialist. I've been working with ONG, obstetrics and gynecology patients for the last 12 years. I've been practicing as a specialist for the last 3 years. I recently joined Enga Provincial Health Authority and I was attached to work at Emmanuel Lutheran Hospital since October of last year. My passion and the reason why I joined ONG is to make a difference in this country. As a student, I learned that PNG is one of the highest neonatal mortality in the world. My aim to come here was to try to revive the ONG services in Wapenamanda District in order to keep the women ONG services in the district. My main problem is I see the patients, I make the diagnosis, but if the patient requires surgical intervention, I have to refer them somewhere to Wabek General Hospital or to Again General Hospital, even though I am able to do the surgery here. I have the skills, but I don't have the facilities to help me do the surgery here. We're referred to either Wabek General Hospital, which is like I said before, which is 1 hour drive from Emmanuel Lutheran Hospital, or to Mount Again Hospital, which is about 3 hours drive. This is quite risky for the patients who are at risk of losing their baby along the way, or losing their own lives during the 1 to 3 hours drive to the next facility. This has caused a lot of problem for the patients. My main concern right now, I am here. I have been provided an anesthetic officer, a lab technician, and 2 theater nurses. But I really need theater equipment and high dependency unit equipment for the post-operative care. So that's why we're making this video, to ask for assistance to help us buy this much needed medical equipment.
My involvement with Emmanuel Lutheran Hospital goes a long way. I have a personal connection to this hospital. My father, late Dr. Timothy Piakalia, was the first Engan doctor, and he was also medical superintendent at this hospital in the early 80s. I spent the first 3 years of my life here before having to go to school. In my capacity as the CEO, when I joined 1 year ago, although the PHA is trying to open a new hospital in Wabek, we quickly realized that not all the district hospitals were functioning at the level that they should, and Mambisanda was no different. So this hospital services the Wapenamanda District. Although it's a church-run facility, the historical position of the hospital and the size of it, it has been the district referral hospital for Wapenamanda since the hospital was built here. And to this day, it is still recognized within our health system as the referral center for Wapenamanda District. This hospital doesn't only receive patients from around Wapenamanda, because it is a church-run facility. A lot of community from around other parts of the district feel comfortable coming here. The people are good, the community is good. When I took over the role, we inserted 2 doctors here who are under the PHA payroll. One of them is a specialist obstetrician. The other one is a general medical officer. We've already also seconded a senior anesthetic officer, a senior midwife, a senior clinical HCO, and we continue to look at other areas to support the operation of the hospital. On top of that, we are working on this proposal because obviously we would like to see the 2 operating theaters open in the hospital, plus the ability to sterilize equipment and sterilize other important hospital material, plus opening up the high dependency ward. So these are the 3 areas that we are hoping to get support for through this grant. And if we are successful, it would allow us to open this hospital to function at a level where it needs to. At the moment, there's only one other hospital in Enga that offers surgical services, and that's the main Wabek Hospital. And if we are able to do that here, it would give a second option to our people, and it would put this hospital at the level that it should be functioning.
Now at least have 25 years something workman lawyer. Me appeal lawyer too. You are me or that you can help him because me community lawyers will go past long. Look at him this blouse coming up now. Before Tumuna Blomi, Papa Blomi look at him coming up now and me plus I look at him.
I'll be talking about the operating theatre. So at the moment I'm anaesthetic officer and I'm in charge of the operating theatre at the moment. So as we go in, the first door we are entering is the sterilizing machine. CSS, the Central Sterilizing Department. So we have two sterilizing machines, but the other one is has got some technical problem and it's not working at the moment. It's being a burden for almost some years. We have one which is currently working but has got some mechanical problem. So at the moment we are not using it. So need some technical expertise to fix this machine. We have got two operating theatre. So the other theatre, there's a couple of issues. I will mention it here. First one is a theatre light, which being installed since that when they build this theatre building. But that theatre light is now not working. Not functioning now. And then we have anaesthetic machine. So we have this machine. It's not working as well. Okay, the other machine is we have got a diatemy machine. That machine is been lying there for quite a long time and then it's not working as well. Some other machines are like a suction machine and patient's monitors. These are all there, but monitors are the probes, BP cup attached to it, all are being malfunctioning. So this is a brief report from the operating theatre.
Running the operations of this hospital, the Emmanuel Lutheran Rural Hospital. I have joined this workforce since 1995 and since then I've been working as a senior nurse specialist working with this hospital. Over the years I have seen this hospital being used and being worn out slowly. I am truly appealing that because of the current situation we have at the hospital, our main operating theatre and all the specialist clinical medical service areas, our X-ray department, our laboratory department and our dental services unit as well as our pharmaceutical, which many years ago, over the last 60 years, this hospital has been serving in terms of operations population in Enga, especially in terms of health needs. And most of our equipments and the whole facility area, been due to wear and tear, it's been worn out, and so we are in real need of replacing all those aging equipments and infrastructure in order that we can continue to provide the service that we used to provide many years ago, since the 1960s up till now. I would very much appreciate if we had partners and donors and friends who can make it their while to help us.